Collaboration and Leadership Reflection video for NURS-FPX4010, Leading People, Processes, and Organizations in an Interprofessional Practice. My name is Marissa Shelton. During this video, I plan to reflect on an interdisciplinary collaboration experience, noting ways in which it was successful and unsuccessful in achieving desired outcomes, identify how poor collaboration can result in inefficient management of human and financial resources, identify best practice leadership strategies from the literature that would improve an interdisciplinary team's ability to achieve its goals, identify best practice interdisciplinary collaboration strategies to help a team achieve its goals and work together. I will also mention authors throughout the video from the literature. First, I will provide some background regarding the topic I will speak about, which includes my personal interdisciplinary collaboration. During my work at a long-term care facility, I was included on being part of the interdisciplinary collaboration while being the quality assurance and infection control nurse. With being the quality assurance and infection control nurse, I collaborated with multiple members of the interdisciplinary healthcare team, such as our administrator, director of nursing, physicians, dietary staff, therapy staff, all nursing staff including staff nurses and CNAs, and also family members. Being the quality assurance and infection control nurse, I was also required to schedule a once-a-month meeting, which included our entire quality assurance members. Monthly, we would all gather and discuss any concerns the staff and family had. This would also include the current infection control rates and identify any trends that were occurring. Then we would determine ways to decrease and/or eliminate those trends by determining teachings to medical staff, current floor staffing, changes in patients' dietary meals, additional cleaning in patients' rooms, or additional laundries for such patient. When the meetings would be completed, for myself, I would conduct the teachings for all the medical staff. For example, those teachings may include going through the basics of pericare or proper hand washing. For the meeting next month, gathering the quality assurance team, we would talk about the changes which were implemented and determine if those changes fixed the problem and were the solution. As stated from the Journal of Interprofessional Care dated 2016, quote, interprofessional collaboration is defined as involvement of different healthcare and social care professions who regularly come together to negotiate and agree on how to solve complex care problems or provide services. Interprofessional collaboration has shown to improve patient outcomes, cost efficiency, healthcare professional satisfaction, and enhance healthy workplaces, end quote. During the quality assurance meetings as an interdisciplinary collaboration team, we were able to determine whether our approaches were successful or unsuccessful. During my personal experience, going through the basics of hand washing or pericares with all the members of the medical staff who perform these duties, it was found to be successful in the desired outcomes as it allowed staff members to ask questions and learn from any deficiencies. Times where it may be unsuccessful is when staff members become upset as it is taking time away from their scheduled duties. When that is brought to our attention, we adjust the schedule for these trainings between shifts, allowing for additional time and minimize the potential for distraction, as the following shift is currently on duty caring for those patients. As stated from the American Psychologist dated 2018, quote, knowledge, skills, and attitudes are not the only determinants of teamwork. The structure of the task and the context in which teams function are critical to understanding and improving teamwork, end quote. Best practice leadership strategies start with effective communication with each member of the interdisciplinary team on how we can achieve our goal. With that, communication with staff members on what our goals are can allow the fellow staff members to communicate with the members of the quality assurance team on different ways our goals can be achieved. Maintaining an open environment and being easily approachable is also best practice leadership strategies, as it allows each staff member to feel that they can openly voice their concerns and opinions without feeling criticism. Allowing effective communication, maintaining an open environment, and being easily approachable allows for improvement of teamwork and leadership strategies. With the communication leadership strategy, it can also be utilized with best practice interdisciplinary collaboration strategy, along with trust, to help the team achieve their goals and work together. If the entire interdisciplinary team can communicate with each other on a realistic goal, then we can establish such goal, working together to achieve the goal. Utilizing trust with each team member can allow the interdisciplinary collaboration to achieve goals. As stated from the BMC Family Practice dated 2016, quote, comprising the planning, agenda setting, structuring, and chairing of the team's meetings is a crucial task in attaining efficient and successful team meetings, as perceived by the participants. They saw the practice nurse as an appropriate person for leading this role. End quote. With this quote being said, being the quality assurance nurse, I am the person who facilitates such meetings each month with the end goal of exceptional patient care. With the VILA activity, ways the interdisciplinary team did not collaborate effectively began with the administrator, Stefan. With Stefan being aware of the implementation coach for Helix, Josh, he could have communicated with Villa Health Corporate on how to determine a smooth transition with HealthX and the employees of Clarion Court. With this communication, it may have prevented the negative implications for the human and financial resources of the interdisciplinary team and the organization as a whole. One leadership strategy which would be used to be effective communication. Utilizing effective communication to improve the team's ability to achieve their goal by allowing each of them to voice their concerns and allowing them to determine a way to solution for the problem. With the care staff, Shonda, Lisa, and Nora, being upset with the IT manager, Chad, about the HealthX not working effectively. I feel they should have provided effective communication with Chad about their concerns, but ensuring they're communicating calmly without criticizing the work of IT. One interdisciplinary collaboration strategy to help the team achieve its goals and work more effectively together would include trust. Allowing trust within the interdisciplinary team would bring each of them together to determine their strengths and how to utilize those strengths with fellow staff members, minimizing the stress and negativity that has been created initially by HealthX. Lessons in which I have learned from my self-reflection in the Villa Health activity is how negativity from management standpoint can affect each person differently, but almost encourages the negativity. Keeping an open mind with new changes can create an open environment for each person to react in their own way, but also allows for each person to voice their opinions and concerns. Thank you.